Hello and welcome to the Clinical Care Options Infectious Disease Podcast. I'm your host, Jacqueline Meredith. This episode features expert insight from a webinar titled Out of the Shadows, Profiling Adult RSV in Your Clinical Practice, featuring Dr. Angela Branche, Associate Professor of Medicine at the University of Rochester in New York, and Dr. Helen Chu, Associate Professor of Medicine at the University of Washington in Seattle. For the full online educational program, including downloadable slides, please visit the link in the show notes for this episode. Now let's get started and hear what our expert faculty have to say about this topic.
So first of all, I wanted to talk about the seasonality and the burden of RSV. RSV is a respiratory virus. It's an RNA virus, like many respiratory viruses such as flu and COVID-19. There are two main subtypes, A and B, and both of them cause disease. And usually we have seasonal outbreaks with RSV, with an onset in the fall in September to November, with a peak in December to mid-February, and then offset in the spring and mid-April to mid-May. The burden of disease due to RSV is substantial. We know that annually there are 2 million outpatient visits in children under age 5, 177,000 hospitalizations in adults over age 65, and 14,000 deaths in adults over the age of 65. This was one of the very first studies that was done looking at RSV disease burden in older adults. This was a study done in Rochester, New York by Doctors Ann Falsey and Ed Walsh, where they profiled individuals who are healthy, older patients living in the community, those who are higher risk, those with underlying cardiac or pulmonary disease, and then people who were hospitalized. And what they did was they tested them for both RSV and for flu. And I think the important thing here to show is that over the course of 4 seasons, we see that the burden of RSV disease in these 3 populations was comparable to that of flu A and flu B, that RSV caused similar proportions of disease in those who were community dwelling and those who were high risk, as well as those who were hospitalized. If you look at more recent data across all of the United States, you can see that this still holds, that the burden of RSV disease is very similar to that of flu in adults age 65 or older. If you compare the numbers of outpatient visits, hospitalizations per year, as well as deaths per year, that RSV causes a similar burden of disease as what we think of for seasonal influenza. And I would just caveat this with saying that this is in individuals who have received flu vaccine, so that the actual burden of flu is probably a little bit higher in those who are unvaccinated. So the most important thing to focus on is that RSV causes disease throughout a lifetime, that many of us think of RSV as a pediatric disease, as something that causes infants to be hospitalized with bronchiolitis, but really it causes disease both through the infant period as well as into young childhood and into adulthood. At a very young age, infants are often protected by maternal antibody that transfers across the placenta during pregnancy. But despite all of this, they still have severe RSV disease. And RSV is, in fact, the number 1 cause of infant hospitalization in the United States. As children get a little bit older, they continue to have severe RSV disease, though not at the rates as when they're under 1 year of age. And then in adulthood, adults tend to have mild upper respiratory tract infections due to RSV, except in those who are at higher risk, including those who have underlying lung disease, such as asthma or COPD. And then when people get older, they tend to have more severe disease due to RSV, with hospitalizations for pneumonia, as well as exacerbations of their COPD and their heart disease. We think of the spectrum of immunity due to RSV at the very beginning. Infants are protected by maternal antibody, but this wanes very rapidly. And really, the innate and the adaptive immune response mature over the course of your childhood and into adulthood. And as you get older, all of these immune defenses start to go down. And then that is part of the reason why older adults tend to have more severe disease. There are certain comorbidities that increase the risk of RSV hospitalization for older adults. This is information from a study using a Medicare database. And you can see that the most important risk factors for hospitalization in older adults include the presence of underlying heart and lung disease, including COPD, congestive heart failure, having a history of a stroke, or chronic kidney disease. Importantly, having an underlying immunocompromising condition, including a hematologic malignancy, also increases your risk for RSV hospitalization, as well as having a history of a transplant, either a solid organ transplant or a stem cell transplant. One of the major factors that predicts severity of RSV disease is age. Here, what you can see is that when they've estimated the incidence of RSV-associated community-acquired pneumonia in adults. In those who are age 50 to 64, there's 0.80 cases per 10,000 person years. And this increases exponentially so that by the time you're over 80 years of age, your risk of community-acquired pneumonia goes up almost sixfold compared to those who are age 50 to 64. RSV is the fifth leading cause of community-acquired pneumonia requiring hospitalization. And importantly, when people do get hospitalized with RSV, they tend to have fairly severe disease. So half of them have radiologically confirmed pneumonia, and 1/5 of them require ventilatory support and intensive care unit hospitalization. On the right, what you can see is a Kaplan-Meier curve, which shows survival of individuals stratified by age in those who are hospitalized with RSV. And at the top in blue is age 60 to 74, and the comparator group is age 75 plus. And the main point of this is that the older you are, the more likely you are to do poorly with your RSV hospitalization, that you're much more likely to die due to RSV, pneumonia, and hospitalization when you're age 75 plus compared to those who are younger at the time of hospitalization. RSV is also a significant cause of nosocomial transmission, particularly in certain high-risk settings like transplant units, psychiatric wards, and long-term care facilities. And really the backbone of prevention of RSV transmission in these settings is early diagnosis and isolation, implementation of isolation precautions, and hopefully with the advent of RSV vaccines, those together will lead to reduction in nosocomial transmission. These are two studies that were done looking at nosocomial transmission in the frail elderly population. So the first on the left is a case that was described in a long-term care facility in North Carolina. And the main thing to focus on here is just the number of cases that showed up in this long-term care facility and the fact that many of them had RSV detected as the cause of the case. In a separate study that was done in Rochester, New York, looking at elderly care home attendings, it was the same result where RSV caused a significant number of cases in these frail elderly, as well as the staff who worked at these places, and followed closely by influenza, coronavirus, and flu B as causes of respiratory illness in these groups. And a lot of this nosocomial transmission of respiratory viruses that happens in these settings, we know from many studies, the introduction is actually through a staff or through a visiting friends and family. So a focus on prevention of transmission has to include testing and masking of people who are sick and visiting these frail elderly populations.
Yeah, that was a really great overview of the risk factors associated with severe disease. I guess of looking at some of what you presented in terms of what's been studied and what's known about RSV and severe RSV, there are a lot of things that appear to be risks for severe disease, underlying medical conditions, age, living in congregate settings. How should the internist or maybe the general practitioner think about these things and weigh them in terms of what's the greatest risk and where you might focus prevention or treatment or testing even?
Well, I think the highest risk populations are going to be those that we saw getting hospitalized and dying of RSV. So older adults, those living in congregate settings, the frail elderly, people with hematologic or oncologic malignancies. Those are the populations where if they come into your practice and they have respiratory illness, RSV should really be part of your differential because an early diagnosis and management of these cases could prevent progression to lower tract disease, hospitalization, intubation, and poor outcomes. So I would say that if you are going to pick a population, that is really the highest risk population I would focus on.
Yeah, and it strikes me that age by itself is an independent risk factor. And so as you age, even if you are a healthy older adult, that's still in itself a risk for severe disease. And then when you add some of these other things on it, like underlying cardiac and pulmonary disease, which many older adults do have, you're really just augmenting the risk of severe disease and severe outcomes. Thinking about age by itself, but then also thinking about what else is going on with your patient population that could make RSV potentially very catastrophic for them. And then, of course, there's the younger people with certain kinds of conditions like chronic kidney disease and hematologic malignancies, to not forget for them as well. Testing, identifying RSV, treating when possible, and then preventing, hopefully in the future, might be important as well.
Absolutely. All of these groups are incredibly high risk. So the key take-home points are that RSV is associated with substantial morbidity and mortality in older adults with a disease burden that is really comparable to seasonal influenza. That age in and of itself, as Dr. Branche has pointed out, the susceptibility and mortality to RSV-associated pneumonia, but that Comorbidities, including CHF, COPD, hematologic malignancy, all increase the risk of hospitalization in adults who develop RSV. The RSV transmission can really occur in many places, in the hospital, in the care home setting, and that this really highlights the importance of early diagnosis and infection precautions. And then eventually, of course, with the onset of or the rollout of vaccines, I think that will also be a critical piece of the prevention of RSV transmission in these high-risk populations.
Thank you very much to our faculty, and thank you to our listeners for joining in. Please be sure to check back for more episodes on important infectious disease topics. Thank you and have a great day.